Good evening, good evening, good evening. Welcome to this evening's webinar. My name is Michael Miner, and I'm the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry. We certainly hope that you will avail yourself. We are restreaming on social media, on our Facebook and Facebook page, Twitter feed, and also on YouTube. We also welcome all that are joining us on Zoom. We do want to take time now to acknowledge our national leadership. We acknowledge our president of our National Baptist Convention, USA Incorporated, Dr. Jerry Young, our general secretary, Dr. Alvin Edwards, the chair of our federal faith-based initiative, Dr. Alvin Love. Today's webinar. Well, in today's webinar, we will have a conversation about the Affordable Care Act. Some of y'all know it as Obamacare, and the 2021 special enrollment period. This evening's webinar is a collaboration of the National Baptist Convention USA Incorporated Hope Health Ministry and Get Covered Mississippi. We're also pleased to have with us representatives from the U.S. Department of Health and Human Services. We certainly hope that you are ready to ask questions, make comments. Feel free to use the chat and type in your question, and we will do our best to respond to those in the Q&A part. For those of you that are watching on social media, we are monitoring our sites, so we'll be able to incorporate your questions as well. We want to make sure that we do the best we can to answer what we can. But now we want to pause just for a second to remind everyone listening about the COVID-19 vaccine. If you have not taken the vaccination, we encourage you to do so today. You can get them almost anywhere these days. I took mine and I'm doing fine. As I always do when I show it, I still have 5 fingers on each hand. I had no side effects, and I got my COVID-19 vaccine. We can do this. If you have already taken the vaccine, praise you. I want you to encourage those in your circle, those that you influence, family and friends. Give them a call and ask them to get vaccinated today. I used to always say when we were having a holiday, I would say, drive safely. The life you save might be mine. I won't say that now because I've taken my shot. But if you don't take your shot, you may put somebody needlessly at risk. So we encourage you to take your COVID-19 vaccination. All right, everybody. We are very fortunate tonight to have a dynamic duo to conduct this evening's webinar. First, let's introduce our moderator. The Reverend Dr. Marion Young Talley is an ordained Baptist minister and associate pastor of the Ferry Street Baptist Church in Jackson, Mississippi. She also serves as a state capitol liaison for Get Covered Mississippi. Dr. Talley has worked with New Way, Mississippi, teaching employment skills to ex-offenders since 2011. She has served as a chaplain at the Boston Medical Center in Boston, Massachusetts, and in churches from California to Massachusetts in various leadership roles. She was named the Billings Preacher of the Year at Harvard Divinity School and has preached at the historic Harvard Divinity School Chapel and the First Church in Cambridge, Massachusetts. Dr. Talley is a retired academic dean from Rusk College and has served as director of graduate programs, professor and chair of the Department of Educational Foundation and Leadership at Jackson State University, and as an instructor and director of the Learning Center at California State University and San Bernardino, California. Dr. Talley has taught in public schools at all levels, from preschool to college, and has served as a school administrator at the school and district level. Dr. Talley attended Tuskegee Institute, received a BS degree from Memphis State University, now the University of Memphis, in education with concentrations in biology and chemistry, and a Master's of Arts and a PhD from Claremont Graduate School. She attended the New Orleans Baptist Theological Seminary and completed 2 years of postdoctoral work in theology and the Master's Divinity program at the Harvard Divinity School. Dr. Talley is an author and has received numerous awards. Dr. Talley has Creative Educator Incorporated, her own consulting firm since 1976. She is immediate past president of Mary Church Terrell Literary Club, president of Church Women United, chaplain for Women for Progress, and a member of Delta Sigma Theta Sorority Incorporated, Pi Lambda Theta, and Phi Beta Kappa. Ladies and gentlemen, Dr. Marion Young Talley. Good evening, Dr. Talley.
Good evening.
All right, now for our special guest panelist, Lisa Carr, MSW. Lisa is a senior advisor at the Centers for Medicare and Medicaid Services, CMS, focused on Medicare, Medicaid, CHIP, that's the Children's Health Insurance Program, and marketplace outreach to faith and other community-based organizations. She's also the designated federal official for the CMS Advisory Committee on Outreach and Education. For 4 years, Lisa served admirably as the Associate Director at the HHS Center for Faith-Based and Neighborhood Partnerships, where she focused on healthcare. She may not look it, but Lisa has over 30 years of public policy and government relations experience with a focus on health and human service policy. For over 10 years, she served as the Senior Director of Public Policy for Lutheran Services of America. Lisa worked for almost 10 years at Catholic Charities USA as their Senior Legislative Representative. Lisa also worked 4.5 years for former Congressman Peter H. Kosmeier, where she focused on health and human services. Lisa received a master's in social work degree from the Catholic University of America and her BA in public policy from Trinity University in Washington, D.C. In her free time, she teaches public policy to graduate students at Notre Dame University in Indiana. She mentors 3 young African-American men whose parents passed away, and she is a deacon in her church. Good evening, Lisa Carr.
Good evening. Thank you.
All right. Now, just before we get started, I want y'all to feel free to type questions or comments in the chat of our Zoomcast and our social media channels. We will do our best to respond to as many questions as we can on air. If necessary, we respond to others by email or post later. And again, we do want to give a shout out to our technical person, Thomas Duke Robinson, who has been doing an excellent job behind the scenes and making sure that we sound good and look good. Now, we turn this session over to Dr. Talley, who will guide us during this evening's session. Dr. Talley, we're in your capable hands.
Thank you so much, Dr. Minor. Welcome once again to everyone watching on Zoom and across the various social media platforms. You know, we throw around a lot of acronyms and so forth. So before we get into the discussion, I want to begin with several definitions so that as we're talking and we're throwing them out, you'll have some idea of who we're talking about. I want to give you the definition of what we mean by NBC USA HOPE, Get Covered Mississippi, and the Affordable Care Act. NBC USA HOPE is the National Baptist Convention USA Incorporated, and it's the Health and Wellness Initiative. It is a collaborative effort of the National Baptist Churches, medical professionals, and health-related organizations. And each one of those are committed to, and that's where the HOPE comes in: health, outreach, prevention, and education. The NBC USA HOPE Health and Human Services Partnership serves as the NBC USA liaison to the U.S. Department of Health and Human Services. Now, Get Covered Mississippi is a statewide faith-based coalition focusing on raising public awareness and engaging consumers about health coverage options available through the Affordable Care Act, or ACA, Medicaid, CHIP, Medicare, and federally qualified community health centers. They promote then the importance of health and wellness. Get Covered Mississippi was birthed from the community health and wellness outreach efforts of the Hill Hernando Baptist Church and the Mid-South Churches Cooperative Conference of the Baptist State Convention. Dr. Minor, Michael O. Minor, who is on tonight, is the executive director, and I serve as the state capital liaison. That is Get Covered Mississippi, is that statewide faith-based coalition. And then the Affordable Care Act, the Comprehensive Health Care Reform Law enacted in March of 2010, sometimes known as ACA, PPACA, or as we say, Obamacare. The law has three primary goals. The first goal is to make affordable health insurance available to more people. The law provides consumers with subsidies or premium tax credits that lower costs for households with income between 100% and 400% of the federal poverty level. You don't have to worry about it. Just when you sign up, we'll tell you what it is. The second goal was to expand the Medicaid program to cover all adults with incomes below 138% of the federal poverty level. And it's too bad, but not all states have expanded their Medicaid program. Not all have participating in that. But the third goal was to support innovative medical care delivery methods designed to lower the cost of healthcare generally. Now, annually, the Affordable Care Act open enrollment period is between November the 1st and it normally ends December the 15th. However, at other times during the year, within whatever the reason may be, you may qualify for what we call a special enrollment period, or an SEP. So let's now go into our conversation. And Lisa, it is an honor to share this conversation with you tonight. So welcome to this evening's webinar. We do understand that you have some important news about Affordable Care Act enrollment for us. Would you share it with us this evening?
Yes, thank you so much, Dr. Talley. And it is an honor and a privilege to be sharing this Zoom platform with you today and to be presenting with all these very strong leaders across our leadership of the National Baptist Convention, USA, Inc. So thank you so much for having us, having me and CMS, the Centers for Medicare and Medicaid Services, to present with you today. So we have very exciting news. Yesterday, we announced that over 2 million people have signed up for coverage in the Affordable Care Act in this marketplace on healthcare.gov and other ways since we've started this special enrollment period. So this is huge news. 2 million people signing up is wonderful. So many people need health insurance during this time. They lost their jobs. They also, have had all kinds of hardship as a result of COVID. So the American Rescue Plan did create this special enrollment period, and we're just thrilled that 2 million people have signed up so far.
Well, that is wonderful news, Lisa. Now, for those of you who are listening, if you or someone you know does not have health insurance, well, they ought to join those millions that Lisa has just told us about who have already enrolled. So Lisa, how can someone join the millions who have already enrolled in the health insurance coverage through the ACA?
That's a great question, and it's not hard at all. If I may, I'd love to share my screen to show people how to enroll. Great, so I'll go ahead and I'm going to share my screen and I'm going to take you all to healthcare.gov. This is our main website for enrolling in the Affordable Care Act. And what we love about this website is it's very easy to understand. We have put everything in a way that people can understand it simply and easily. It's even in Spanish. If we click this Espanol page, button here, the whole website turns to Spanish. We have everything from how to get coverage, how to keep and update your plan, how to get answers to your questions. But right here, you can see in the middle of the page, here's how you can get lower costs are here and how to find health coverage now. You can enroll or change plans due to the COVID-19 emergency through August 15th. So that's 1 month from today. You have 1 month to sign up for coverage, and you can see if you qualify for Medicaid or the Children's Health Insurance Program at the same time that you're on this website. So 3 programs, the Health Insurance Marketplace, Medicaid, and CHIP. You can all find that right here. And you just click on this button, take the first step to apply to go ahead and enroll in health insurance.
Well, thank you for sharing that information. And everyone watching should take time to review this website and share this valuable information in their own networks. Now, Lisa, can people still get 2021 health insurance coverage because we have passed the normal date through healthcare.gov?
They can, and we're so excited about this new special enrollment period. This special enrollment period that we're in now is different than others. People can enroll in this special enrollment period, this unique one, until August 15th. And this one is really for anybody. You can switch your plans. You can see the button here, update or change your plans to save if you already have a marketplace plan, or you can go ahead and apply for the first time. And anyone can do this. We're really excited that this is for anybody who does not have health insurance or wants to get shop to see if they can get a better option. I should say this is a little different than our other special enrollment periods. Usually in the fall when we have open enrollment, that's usually November to December. And when that closes around December 15th, we have a special enrollment period starts then. When this period closes August 15th, there'll be another different kind of special enrollment period. So when we close those, when we say we're done August 15th or done December 15th, then we go into the other special enrollment period. And those are really a little bit different. That's when you have a life plan change. You get married or you have a baby, or you change jobs, or you change states, you move from one state to the other. So when you have these life changes or life events, that's where you have 60 days from that life event to go ahead and enroll and save. So all the answers are right here on this website. Come to healthcare.gov and you'll see the information about the special enrollment period and what your opportunities are to save money.
Well, Lisa, you've talked about the 2 kinds of SEP. Do I need to confirm my eligibility for the 2021 SEP?
That's such a good question. Many people get information in the mail and they don't always understand what that is. What are they supposed to do with that information? So they oftentimes do send some information, some documents to confirm the life events or to confirm perhaps your immigration status. It's important to fill those out and send them in before you use your coverage, because we need those documents to make sure you are eligible before you use your coverage. So take any documents that you receive from us, just read those carefully, and you want to go ahead and send those in as soon as you can to be able to get your coverage as soon as possible.
All right. Well, now, where can I find the 2021 marketplace plans and prices?
That's a great question. That's a really good question. We have something here called window shopping. So I'm going to put this right in our search button and press search. And you'll see you can preview health plans and prices based on your income. This is one of my favorite parts of the website. And we're able to see plans and prices even before you buy them. So all you do is enter your zip code. I'm going to enter mine here in Virginia. I'll say I'm in Fairfax County, Virginia. And then you just need to fill information about your household. And you can skip these and just look right at the plans. You can look at all these plans and prices. They're different kinds of plans. Now, these are without the savings because I did not put in my income. But you can see the bronze plans, the silver, the gold, the platinum. And then you can see all the different plans that are available here and compare them. Now, again, these are very expensive plans because I said I made $1 million, that I didn't put in my money. But you can see the types of plans. They're all really helpful. And if I put in my income, you'd be seeing very affordable plans. It'd be great. So I wanted to make it a little faster for you today so you can see these, but you can see the plans and prices right here. Again, very affordable if you put in your own income.
Well, now looking at those, that would really be something for most folks. But now, if I go to and try to enroll in a special enrollment period, will I still qualify for those premium tax credits then? Because I need those prices, those premiums to come down.
That is very true. That is very true. And we know that with the special savings that are available as a result of the American Rescue Plan, 4 out of 5 individuals can qualify for savings and qualify for a plan that is $10 or less per month. $10 or less per month. 4 out of 5 people. And then so that's great news. And for families, we know that families, their premiums will decrease $50 a person and $85 a month per household. So that's a huge savings as well. And if someone if a person was on unemployment compensation in this year, in 2021, for at least 1 week, many places call this unemployment insurance. So if someone lost their job due to COVID in 2021 and had unemployment for 1 week, they can come on healthcare.gov right now and get savings that are significant. And many people are getting plans for free. The plans don't cost anything. So that's the case for unemployment compensation. This provision just started on July 1st. And we have a whole page on it. If you put in the search button, extra savings or unemployment compensation, you'll see all the information, but it's extra savings that are available for people who have been on unemployment.
All right then. Now, we know that one would have to have some kind of income, but what do I count as income? And do I have to include everybody in my household? How does that work?
That's such a good question, because many people think they should include other people that might be living in their house, like roommates or other folks that are, sharing the home with them. But the only people that need to be included are the people that you put on your tax form. So your spouse and your dependents. That's who needs to. That's your household. And then for your income, you want to look at your adjusted gross income for this year. So how much money you're going to make for this year. And that's what it should be based on, not last year or what you think for future years, but just this year. And that's when you're going to be paying your taxes based on your income for this year. So it's based on this year's amount of income.
All right. Now, I have worked with individuals who are self-employed. What about them if they're the sole proprietor or self-employed?
That is a really good point. A lot of people are self-employed and insurance is very expensive for them. So if it's just one person that's employed, then they should come here to the healthcare.gov website to get health insurance. For one person, this is the place to go. If you have 2 to 50 employees, so yourself and one other person, up to 50, you'll be eligible for SHOP, which is a small business health options program. And SHOP is now being operated by agents and brokers. And so you can go ahead, and if we put in SHOP, you'll see more information about SHOP here. You can see overview of the SHOP marketplace, the parts for employers. We have all kinds of great information here, SHOP resources, but you need to go to an agent and broker that works with SHOP. So all the information here is on our pages on where to find that agent and broker for SHOP if you have between 2 and 50 employees.
All right then. Now let's say I've got my insurance. How do I pay my monthly premiums?
That's a good question. Can be so confusing. And your health insurance doesn't start until after you pay that first premium. You need to pay it to the health insurance company that you're with. So whichever one you sign up for, that's the one you need to pay it to. Don't pay it to healthcare.gov or any whoever helped you sign up for health insurance. It's only to the company that you bought the health insurance from. So when I showed you the window shopping tool, you saw Aetna, Cigna, Blue Cross Blue Shield. Those are private companies that are on healthcare.gov, and that's who you pay your health insurance premium to.
One of the things that I've noticed when we're working with people and helping them out, there's one of the last pages says you're almost done. And normally it'll have the telephone number and give you some instructions on how to pay that premium. Well,
yes.
Let me ask you also now, what kind of preventive services are available under the health insurance marketplace plan?
Boy, that's a great question. And I know we have, there's 10 preventive health benefits that are available. They are right here on our screen. So you can see those to the right. It's everything from ambulatory patient services, emergency services, hospitalization, pregnancy, maternity care, newborn care. We have mental health and substance use disorder, which is so important during COVID, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and pediatric services. And we know that for children, they also oftentimes have dental services as part of these plans as well. So this is exciting. Many important services are part of these plans.
All right then. Now, the National Baptist Convention, USA, actively promotes the ACA's preventive services on our social media platform using the Office of Minority Health Coverage to Care initiative. Lisa, where can I get tips then on using my health insurance?
That's a great question. And I'm going to share with you my Coverage to Care materials. You'll see here, this is the Office of Minority Health's website from CMS, and they have lots of great from Coverage to Care resources that we think you all would love. You can see we have everything from a roadmap to better care, 5 ways to use the most of your coverage, all the prevention resources, telehealth resources, which is really helpful now that people are using telehealth, even COVID-19 resources. So all of these are very helpful. I'm going to scroll down more and you'll even see we have materials in many different languages. These are the different kinds of resources we have. But I'm going to click on 5 ways to make the most of your coverage. And you'll see here, this is so helpful. These are 1-pagers. You want to confirm your coverage, know where to go for care, find a provider, make an appointment, fill your prescription. All of having health insurance can be very confusing. So we want to make sure that they have all the people have the resources that they need. And here's more of the resources we have: new COVID-19 resources, telehealth. We even have one on how to pay for your healthcare costs, which is obviously a huge issue with a lot of folks. We have an enrollment toolkit, lots of great information. So we really encourage you to use these. This is all on the CMS website. I can put this in the chat function so folks can have this. But it is a wonderful resources for folks to have. Again, it's all from the CMS Office of Minority Health. If you even just Google CMS Office of Minority Health, you'll find these resources here. And they have them in about 8 to 10 languages, depending on the resource. So if you're helping, or friends or family speak different languages, we probably have the materials in the language that you need. So we're really excited about this.
All right, then. Thank you. This is really great in terms of what you're sharing with us. We know, though, that life happens, and sometimes after you've signed up, you need to report changes. How do you report changes to your income or your family or your address? How do you do that?
That's a really good question. You do want to go back here to healthcare.gov. I'm just going to share the screen again, and you can see at the bottom how we can connect with folks. So on the bottom right-hand side, it says connect with us. You can report changes 3 ways. The first is online, right here on healthcare.gov. If I go to the top, you can see right here on the top right side, it says log in. So if you have health insurance through the marketplace, you can log in and make the changes there using your password and that kind of thing. Or you can call, and here's the phone number right down here. This phone number is available 24 hours a day, 7 days a week. And we have assistance in 150 languages. So we're very excited about that. We also have a TTY number if someone has hearing challenges. And the other way to do this is in person, so you can find local help. I'm going to click on that, and you can just put in your city and zip code. If I put in mine, I'll say I'm in Alexandria, Virginia, and here's all the places I can get local help. You can see I'm in a very diverse community, lots of places to get help. So, and lots of different languages. So this is what Dr. Miner, he would show up if I put in Mississippi, you'd find Dr. Miner here. So this is the place to go to get in-person assistance. The one thing you don't want to do is don't mail it in. We don't like mail for changes of your income or address. We want you to do it through phone, through logging in and online, or by finding local help.
Oh, okay, that sounds good. There is something that has bothered me. Where I live, I see a lot of signs posted around the city talking about Obamacare. And then I called the number listed, and it was clear to me that the salesperson was selling something that was totally different from Obamacare. I just need to interject, just throw this in, Lisa, because there's some major differences between the marketplace and healthcare.gov and those cheap health insurance alternatives. Now, let me interject this with you. We have, I think online, I don't know if there's any way to even enlarge that, but if we compare the two, if we compare those plans that you would get on the marketplace and those plans that I call them short-term plans, there are some things that we can look at, and then you can see that there is a real big difference. First, for example, if you ask the question, could you be denied coverage for having a pre-existing condition? I just worked with a person, and he was reluctant to get insurance because he thought he had pre-existing conditions. Well, on healthcare.gov, then you can still get a plan. You cannot be denied a plan on healthcare.gov. However, that is not true for some of those plans that you would get in the short-term plans. then would you be charged more for having a pre-existing condition? That was another question that I was asked. Well, on healthcare.gov, no. You have to be charged the same thing as anyone else who is applying for insurance, but it varies in those other plans. You may or may not have to pay for that. And then you had talked about before, you gave us that list of those 10 essential benefits. Well, all of those are covered then on plans you would get for healthcare.gov, but that may not be true for some of those short-term plans. We asked the question, is care for health conditions you already have before you buy the policy covered? And yes, it is. Simply because it is something that happened prior to you buying the policy, it is covered, but it varies, of course, in those short-term plans. Now, one of the things we ask, can the plan include a limit on what the insurance company will pay for covered services during the year or in your lifetime? And we have individuals who will rack up because of a condition and so forth, and then they hit a limit and then the house is gone and everything else. On healthcare, if you got a policy on healthcare.gov, then there can be no lifetime limit or no yearly limit. But that is not true in those short-term plans. Some of those will have lifetime limits, and some will even have limits in terms of how much they will pay within the year. And finally, can you get assistance to lower premiums or out-of-pocket costs? Well, we all know that in healthcare.gov, you can qualify for a premium tax credit. However, you do not get any kind of premium tax credit with those short-term plans. I hope you forgive. I just needed to throw that in because it was just kind of bothering me as we were talking about plans and thinking about some of the folks I have worked with. But let me get back, please, ask you. We understand that today begins that 30-day countdown to the end of 2021 special enrollment period. Would you share about CMS, ACA Summer Sprint Marketing Campaign?
Great. Yes, we're very excited. Today is the first day of our summer sprint to the end of this special enrollment period. It starts today, July 15th, and it goes until August 15th. And every week we're going to be sharing testimonials, new data, new information about this special enrollment period. So this week, and we're sharing 3 testimonials. They're going to be on all of the major television stations, on sports events. We're going to be sharing them across any kind of digital platform like Twitter and Facebook. So we're excited about the 3 testimonials that came out today, videos on YouTube. And then we're also going to be sharing lots of different new social media messages and other advertisements on TV, on radio, on digital platforms. So we look forward to sharing more information with you as we have those available.
That sounds really good, Lisa. Now, we've come to the end of my question. So is there anything else that you would like to cover before we transition to the question and answer period? And I would, as Dr. Miner told everyone, you may use the chat or in social media and for your questions. But do you have anything else you'd like to share before we transition?
You know, I do have one thing I wanted to point out with you, and I'm going to share my screen just one more time. We have a really helpful toolkit. I'm going to give it to you here, and this toolkit is great. It does have lots of really helpful information. I'll just pull it up right here. This toolkit is it's specially for the open enrollment. There it is. It's called the healthcare.gov Special Enrollment Period 2021. At the top, you can see the Weeks of Action Communication Toolkit, and then the Communication and Outreach Plan. And then we have some schedules there, but we have fact sheets in different languages. You can see English, Spanish, Arabic, etc. And then social media posts, downloadable images, TV ads, some of our TV ads that are new These are the testimonials that just came out today. The testimonial for Dorothy, for Daryl and Erica and Jeremy, and then 5 things to know about the special enrollment period video, and then lots of fillable flyers in different languages. The one thing I did want to tell you all is that if you have the opportunity this weekend to share information about the special enrollment period during your announcement time at church, or if you wanted to announce it, weave it into your sermon, this Weeks of Action Toolkit has all of your talking points. Anything you want to put in there, it's all right here. We have talking points, we have a pulpit announcement, a bulletin announcement, it's all right there. You can use this for the next whole month. It's all going to be correct until August 15th. So we encourage you to use this. I can put the link for this also in the chat function for you all. And for those that aren't on the page who are listening through other services on social media, this is on marketplace.cms.gov, and it's under Spotlight. So I'm going to move up here and you can see cms.gov under Spotlight. This is the main page here. So I will stop sharing and share. That's our main page. Great.
Oh, all right. Now I think we've got some questions coming up. And first, Dr. Minor, do you have any questions on social media that you want to ask at this time?
Well, since we good evening again to everyone. Since we got some earlier, we'll type them into the chat for you, so you can get started. And as we get them, we'll keep going that way until we run out. So have at it.
All right, then. Well, now let me go up through the chat and to see. I think the first one that I have is that there are no deductibles or copay for preventive services covered under the ACA, including your annual physical. And
well, Dr. Tyler, we should have some direct questions to you.
Okay.
And your directly posted to you.
All right, then let me see. I don't.
Okay, well, I got it for you.
All right, then. I'm.
Don't worry. I got to see you straining there. I got you.
Okay.
All right. The first question we have is this: Do I have to use an insurance broker to assist me in enrolling for coverage?
Okay.
That's a good question. Do you have to use an insurance or broker to assist you with coverage? No, you definitely do not need to do that. You can go right here to healthcare.gov, where that page I was at before, healthcare.gov, and go do it right on yourself. I've done that many times myself. I have been oftentimes to healthcare.gov and helped people myself, showed them what it is, especially with limited English proficiency. So this website is so easy to use, and I'm just going to share that again. It is so easy. So you can do it yourself. You can call our phone number right down here at the bottom. If you want to do it by phone, if you're speaking another language and want help in another language, they can get you a person that speaks that language. We do have 150 languages. That's a lot. So that's oftentimes helpful to get it in the language that you're comfortable with. And then you can go find local help. You can meet people like Dr. Minor and get assistance from a friendly person that can explain it to you, because health insurance is confusing, and it helps to talk to someone that you trust and that you know will look after you and will get you the right plan for you and your family.
Yes, and if you don't have the telephone number for Get Covered Mississippi, you can put your zip code in the into the instrument and where you ask for local help, and Get Covered Mississippi will have navigators all across Mississippi who can help you. And who work with
Let's
you.
put in 38618.
Okay. 38618, and it'll tell you about all navigators all across Mississippi, Jackson, and all the other places. Next question: are the premiums that you showed good nationwide? The base prices are a lot higher where I live, this person said.
Boy, that's a good question. That the prices vary. The prices do vary depending on where you live. And so part of that is the health insurance companies. They're working with those states where they offer them. Now, the federal government runs a bunch of these health insurance marketplaces, but the states operate a bunch too. So the prices and the coverage vary. Well, the prices at least change from state to state for sure.
All right then. Here's one. My kids are covered by CHIP. Can I get covered under Obamacare?
Oh, that's a good one. That's a really good question. You definitely should go to healthcare.gov and push the button to apply. Go ahead if you go. I'm going to share our Hernando Church here, but if you go back to healthcare.gov, if you take this first step to apply, go ahead and start filling out the information, create an account. Or if you don't want to create an account and start, you can see it says start with your state, just do window shopping and put in the information there. You can window shop even before you buy a plan. It's just like you can check it out for yourself and see what works for you. So you can see the plans and prices, preview them before you buy them. Again, you need to put in your income to get those different plans that are a fit for you. And we tell people to check all of the different levels of care, different levels of insurance. There's silver, bronze, gold, and platinum.
Oh, I think you froze, Lisa. I believe hopefully she will freeze in a little while. We know we were talking about that in our session this morning, that very question.
But the silver and bronze are a little bit less money, and so you get different services for those.
All right. I'm not sure at what point you froze, but I know.
Oh, sorry. It did say my internet is unstable, so I apologize for that. So I can tell you there's 4 different kinds of levels of plans. Bronze, silver, gold, and platinum, and look at all of them, but especially the silver level plans, because sometimes they have extra savings under silver.
What is the difference between the Affordable Care Act and Obamacare?
All right, I didn't make this up, so go right ahead.
Okay.
Great. Well, they are the same thing. And it is very confusing because we call it all these different things. We keep changing the name, so it can be very confusing. But Obamacare is the Affordable Care Act. Some people also call this healthcare.gov by our name of the website. They also call it the Health Insurance Marketplace or the Health Insurance Exchange. So I apologize for the poor naming of. We should have just kept to a one name and not kept changing it all the time, but it's all the same thing.
All right then. Now, is Obamacare a governmental insurance program like Medicare?
Boy, that's a great question. No, it's not. It is. It's basically a platform where we are offering private health insurance to people, and if their incomes are lower, we offer subsidies to help them pay for it. And I'm going to turn this to Dr. Miner to see if he has other thoughts about how to explain this.
All right, well, it's real simple how to look at this, everybody. And the reason I can do this both as a navigator and I'm covered in coverage through the ACA. So what I do is I go on it, I select insurance through a publicly traded insurance company. So think about it this way, folks. I think of the healthcare.gov as if I want a job. And you know, when you're on a job and they have these health plans, we come in and can get pick your health insurance coverage for the year. That's what we do on healthcare.gov. I'm not picking a government plan. I am picking an insurance policy through an insurance company. I'm not going to name the companies that I have, but they're common name companies that you see on there. All the healthcare.gov does is allow to bring all these insurance companies in one place. That's why they call it a marketplace. and they have all the plans listed. It's like going to the grocery store. And I look at it and determine, based upon my doctors, the medications I have, the locations of maybe some specialists, and look at it and pick out the best plan that I'm able to afford. But no, it is not like Medicare, where it is a federally, it's a government program. It is private insurance offered through a federally facilitated marketplace. Again, private insurance through a federally facilitated marketplace. And it works great. I just got my physical this week through it. Didn't have to pay anything for it because it's covered under the ACA.
All right, thank you. Next question. I'm 62 and thinking about retirement. I'm still working to keep my health insurance coverage. Can I get coverage through Obamacare to tide me over until I retire?
Yeah, I'll answer that. Yes, you can. And that's a great way to get health insurance, is to go ahead and get it right here. It's for anybody. When you apply, it'll tell you what you're eligible for. So families that have multiple people with different ages, it'll tell you when you put in the ages of your family members, if they're eligible for the Children's Health Insurance Program, or maybe they're eligible for Medicare, and it will say, you're eligible for Medicare and you can't apply here. So go to medicare.gov. So, but if you're, most people are going to be eligible for the marketplace. People who are in the 18 to 65 age range should be eligible for the health insurance marketplace for healthcare.gov coverage. So we encourage you to come here and take that first step to apply.
Oh, this is a good one. If I don't like my coverage, can I cancel?
Great question. Right here, it says update and change plans. Yes, you can shop for better plans, or you can stop your coverage. People do that all the time. So this is a great place to, it's worth looking at, seeing if you can change plans if you don't like it. During open enrollment periods and this special enrollment period, you can change plans. And we're encouraging people to come back and shop and save, because the plans are cheaper than they've ever been as a result of the American Rescue Plan. And we encourage people to see, maybe they can get more savings. And open enrollment and this special enrollment period is the time to shop and save.
All right, here's another good one. My grandson is in college and needs coverage. I have custody of him. Can I enroll him?
Great. Yes. He can get health insurance for sure through the marketplace. Sometimes it's a little tricky because it is based on your state. So he's going to want to figure out where he wants to get coverage. Oftentimes when people are in college most of the year, if they get sick there, they're going to want to get coverage where they are most of the year for sure. So I'm going to ask if Dr. Miner has anything else he'd like to add for this, as he's an expert on this issue.
All right. Well, I'm an expert by trial and error. We've had a couple situations. We've had somebody that's here in the state of Mississippi. They had cussed their grandson. They filed them on their income taxes, and because of that, the grandmother was covered under Medicare. So she didn't need the coverage. So she went through the marketplace and she enrolled her grandson, for coverage, and he was covered. In another case, it actually turns out that the college that he went to, they had a plan through the college that they were able to take care of him. And because he was there during the summer, whatnot, it worked out fine for him. And you are right, if they're go out of state and have to get some coverage. I've had all kinds of issues with that. The 3 or 4 that I've done since 2013, either they ended up doing something through the college, or they were able to work something out with the insurer that they were able to still cover the child, even though they were out of state. But I would strongly suggest that whoever the person is that asks this question, or anybody that falls in a similar situation, to go through the marketplace and give it a shot and try. And above all, make sure you check with the college and see what they have as coverage as well.
And I might add too that I just had a case where the same thing, the aunt had the child on her income taxes, and she wanted to cover her. She was going to college out of state. We were actually able to contact a navigator in the other state. So that the navigator then was able to write the student up. So that I would say, go to the marketplace.
Yeah, definitely.
Navigator, yeah, and we talk to each other. Right? Let me see. Now the next one is a good one again. Will my prescription still be covered if I enroll in Obamacare?
And I'm going to ask Dr. Miner. I think he has the answer to this one too.
Well, I'm not going to name the names of people about prescriptions, but what you do is very simple. And I've done this when we looked at coverage ourselves. I have out my list of prescriptions, and when you go in, even when you're shopping, you can go into the healthcare.gov and you look at the formulary of what the plans cover. And I suggest to you is to make sure, sometimes, like for me, I can't take the generic. I have to take the name brand drug. So you want to make sure, looking down on that they will cover that. We've had some situations where people were all excited because they switched from plan, even in the marketplace, that one was less expensive. But what turned out, it was less expensive, but their particular medication was not covered. And so they had to pay for that separately. So what you need to do is go through, check it out, look at it, won't be a problem. I even went so far as to check with my pharmacy and with my doctor's office. You got time, folks, and checked everything out, and it was not a problem.
And there is, when you're signing up, and when you're on the marketplace and you're looking, each one of the plans will have their formulary. They will have their booklets on it. They'll have doctors, and you can check all of that out before you sign up. Matter of fact, we do that routinely before we sign anyone up. Okay. Next question. Thinking about retirement this year, so I will be losing, I guess, half of my income. Will it be able to keep my insurance?
That's a great question. And it is a little complicated, right? Because it depends if you're Medicare eligible, or you might have a retirement health insurance plan. But you definitely want to go to healthcare.gov and go ahead and take that first step to apply, or preview the plans and prices, and see what it says. It'll tell you what your price is going to be and what your coverage is, what your options are. So we really encourage you to go to healthcare.gov or call that phone number, the 800 number, or even just go talk to someone like Dr. Miner or others that are people that are navigators and assisters that can help you in your community.
All right. This is the last question that we have. If this coming up for Dr. Tyler, we don't have any more social media. Unless Duke has something.
All right, then this one is: if you get sick out of state, are you covered?
Well, that's a really good question, because a lot of these plans are state-based plans, or they're federal plans. So you're going to want to look at that when you go ahead and enroll in coverage, and you should ask that when you're looking at coverage. We also get the question, will I be covered if I go overseas? Perhaps you're visiting relatives or friends overseas or on vacation. What happens if you're overseas and you need coverage? So those are things you got to ask when you're looking for insurance, to see if what it covers. And Dr. Miner may have something else to add on this.
Well, unfortunately, I did get sick out of state, out of the healthcare, but because it was an emergency, it was covered. When I got back home, I saw the little letter said that because I was out of the state and it was emergency, so on and so forth. So typically, if it's out of state it's probably something that's going to happen to you, an onset of something or whatnot. Typically, most insurance companies are going to work with you in getting it done. But just like Lisa says, you want to make sure you check all these things out. And look, I would go a step further. Even if you are well and everything is going fine, you still want to find out anyhow what those things are. So if you are out of town, what those steps are going to be. Because if the insurance bills can be very expensive, very expensive. So you want to make sure that you're all set beforehand. All right.
Well, that's it. No more questions, Duke.
Do we have another question on your social media sites?
No, sir.
Okay. So Dr. Tyler, that's all the questions we have, Lisa. We're done with questions. And look, we do want to remind everyone that when we do end the social media part of the broadcast, Lisa is considered staying for a few minutes for those that are on Zoom. So back in your hands, Dr. Tyler.
Oh, all right. Well, Lisa, thank you so much. You have really enlightened us this evening. You've done a wonderful job. We'd also like to applaud the Biden administration for its bold efforts to expand marketing and the enrollment opportunities for the ACA, this special enrollment period from May through August. And thank you again for participating.
My pleasure. Thank you so much. It's been a privilege to be with you today.
Well, all right then. Now, as a reminder to those who are listening, you will find additional information and resources on the National Baptist Convention USA HOPE webpage, and that is www.hopenbc.com, www.hopenbc.com. Now, I too join Dr. Minor in encouraging everyone who is listening to please take that COVID-19 vaccination. We know that Delta strand is not playing. And I took my shot, and I am fine too. Now that we have opened up and this session, I'm trying to get to the end. Okay, now that we've completed with our question and answer session, let's not forget our July marketing updates. It is still our summer and health wellness vacation Bible school, and it is also the National Minority Mental Health Awareness Month. You can join us on our web and social media pages, the web page at HOPEBCNBC.com, on our Facebook page, the National Baptist Convention USA Incorporated Hope Health Initiative. Our Twitter feed is at @Hope_NBC USA, and our YouTube channel, which is NBC USA Hope. We would appreciate your feedback. Would you kindly compare our website survey? We pasted it in the link, in the chat link. And we would ask that you would respond to that. It is the https hopenbc.com/webinar_survey. We do appreciate the tireless work of our NBC USA HOPE team, who work tirelessly with these webinars and with trying to work in terms of individuals, especially here in Mississippi, trying hopefully to get as many people as we can signed up. And so let me just thank our HOPE NBC team with Ms. Lottie Minor, Pastor Bernard Montgomery, Sister Bettina Campbell, Pastor Dexter Moraney, Ellen McKnight, Felicia Washington, Minister Geraldine Moore, Dr. Desi Levy, Linda Copper, forgive me, Copper, Loretta Miller, Dr. Laveria Williams, Nettie Johnson, Michelle Johnson, and of course, I work with them as the state liaison. Once again, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a presentation and a production of the National Baptist Convention, USA Incorporated, which is the largest, the nation's largest Black denomination. And so, as we leave now, we would say, God bless you and keep you. And that is our prayer.